In this short video, I will describe some basic shoulder anatomy, which I hope will help patients understand their shoulder problems. The shoulder, or glenohumeral joint, is a ball and socket joint. The ball is at the top of the arm bone, the humerus, and the socket is the glenoid, which is part of the shoulder blade, or scapula. The glenohumeral joint is surrounded by a sleeve of tissue called the capsule. The capsule is thickened in places, forming ligaments. Outside the capsule are the tendons of the rotator cuff. Tendons are where muscles attach to bone. Muscle, pulling on bones through the tendons, produces movements at joints. The rotator cuff is composed of 4 tendons. Subscapularis is at the front of the glenohumeral joint. Supraspinatus and infraspinatus are at the top of the shoulder joint, and teres minor is at the back. The rotator cuff tendons blend together at their insertion around the top of the humerus, forming a continuous sleeve of tissue. Above the rotator cuff is the acromion, which is the bone you can feel on the top of your shoulder. The acromion is part of the shoulder blade or scapula. The subacromial space is a space between the undersurface of the acromion and above the rotator cuff. The subdeltoid or subacromial bursa, which is a sac of fluid, occupies the subacromial space. At the front and on top of the shoulder, the acromion articulates with the collarbone or clavicle. This forms the acromioclavicular joint or AC joint. The AC joint is stabilized by the AC joint capsule and the coracoclavicular ligaments, which link the coracoid process to the clavicle. The strong muscle at the front of your arm is called the biceps muscle. It is so called because it has 2 tendons. One, the long head or LHB, is attached to the top of the socket of the shoulder joint. The second tendon is attached to the coracoid process, which is part of the scapula. The coracoid is a finger-like projection of bone that you can feel about 4 centimeters below the outer edge of your clavicle. The 2 tendons of the biceps join together to form the biceps muscle at the top of the arm. All of the structures that we've mentioned may be affected by wear and tear or injury and may cause symptoms in the shoulder.